I'm a nurse, a registered nurse, working at Nasusi dispensary and I'm in charge. And I'm also a peer educator supervisor. Basically, this is a person who is HIV positive, then has some basic knowledge on HIV, and this person is willing to work with the people who are living with HIV. So this is a peer educator. He's able to work with them that are infected and help them grow. What we do, first of all, we have criteria that we put across. So before we choose one, for us to get the right person, we first have to advertise for the post of a peer educator. This person must be 1, HIV positive. 2, he should be coming from that community because we are able to trace another person through them. Then this person should also be attending our PSSG, the support group, peer support group. Then he's a person who is supposed to be taking the drugs or is on the program from the facility. So that means we know about his or her adherence. So this person must be willing, must have disclosed her status or his status to other people. So that is what we do. So after we have advertised using those criteria, they come to the facility, we book a date for them for an interview because they can be more than what you need because we go by the number of people we want. Like a facility like Nasusi, we needed only 1 and we had 10 applicants. So we called for an interview. Then through the interview, we are able to assess them through and see their competence in writing, if they can communicate, their willingness to disclose it. Then we can follow them through our records. Then through there we can actually get the right person. It is not hard to get.
In kimilili, I normally, when the patient is tested and found to be positive, I do enrollment in the CCC. Then, if at all the patient goes away, anyway, when I do enrollment, I normally tell the patient to go for CD4 count. Then after that, when the CD4 count is low, when the results comes out, then we normally call the patient through phone to come and to be started the ARVs.
Okay.
And I also do filing of the CD4 count results, the documents of the patients like TB screening forms. I do file them. Then also I do healthy talks to them when it is the clinic day. When the patient comes in the morning, the first thing we give the healthy talk. I give the healthy talk about nutrition, drug adherence, and also STI control, use of condoms. And also default tracing. Sometimes we normally use our phones. We request them to leave their telephone numbers. So when the person has got lost, we use telephone numbers to look for that person if he or she has lost from the care. We normally have the sketch maps which can lead us to where they come from, the area, the name of the neighbor, or the nearby school, the nearby church. It normally leads us to where the patient comes from.
This is a person who should work closely with me as an in charge. He is to help us through the counseling, the pre and post counseling. He can do the testing. He can answer 1 or 2 questions from the patients. He or she, if there is a question that he cannot answer, he is able to come to us or to me, or I have my colleague. She can consult, then we can answer the question. So this person also is supposed to keep the records of the clients, keep the files, track the defaulters. Then it's also able to give us, in case there is any problem, it's able to let us know. Then we sort it out. So that
We don't force the patient to take the drugs where he or she don't like, and that is stigma. We just tell him or her to tell us where she is free to go and pick her drugs. By the time she will continue, the stigma will go away, and then she will eventually decide where to take the drugs.
like we had one guy who used to work as a peer educator. This person had a problem. He could not disclose it first to the people. He's not ready, or rather willing, to share it with others what he's passing through. And when we recruit one as a peer educator, we're supposed to give health education and then help others through their process of accepting. They go through stages. Sometimes people deny. So this person most of the time was missing in the facility. So you wonder what kind of a peer educator is this. Then when you go searching for them, when you see him delivering the services, it was not up to the standard. And actually that is why we had to have another interview and recruit another person.
Me, I reached at a time and I saw it is just normal. You can just live life like as any other person. So I took it like that, and I normally disclose my status to patients, other people, and by doing that, I came to gain courage of telling other people that, and by doing so, I found myself strong, no fear of telling people about my status.
Oh,
yeah. Some of them even could not like sharing things with me. Even some of them, they saw as if I'm not important. Once I find some client is having stigma, I normally advise him or her to be free, because this thing is there and it is a killer to people who are living with HIV. So I normally encourage them to be free and to accept the status and live like other people, not having any fear that, oh, tomorrow I will die. And yet any person can die, not only those ones who are HIV positive.
These peer educators, they come from the facility and they know most of these people when they come. So they're able to help them reduce their stigma, as in they know this one is positive and she's the one attending to me. So they have the confidence with their own people. It has also helped us reduce the issues of adherence. So people are able to come, and if they fail to come, she can trace them to their doorsteps. So she goes there, then they are able to come back. Then through her and our community health workers, we find that the referrals, that the people, maybe they have coughed or they are not willing to come. So when they come, they are referred to the facility, and through how we coordinating together, you find positive cases starting with treatment. So to us, it is working.
When the client is the first day, if he or she is from the VCT and she is tested and she has been found positive, it is that the time when I have to discuss with her, counsel her, give her encouragement, tell her how she should stay and continue in HIV and positive living life. Some people, when they are found positive, they cry, they don't accept the status. Even some of them, when you tell them that I myself am positive, and that is what I'm encountering, they don't believe. They say you are cheating, you are using this language in the way that you want to capture us here when you are not positive. They don't accept. You can encourage them to be free and disclose their status to others, so that we may stop further spreading of the disease.